The final suture is placed, and the overhead lights dim. At this moment, the surgical intervention is over. Patients often assume that leaving the operating room means the hardest part is behind them, that healing will simply happen to them while they lie still in a hospital bed. The clinical reality is entirely different. Functional recovery from thoracic surgery is an active, demanding, multi-system physiological protocol. It relies precisely on the continuous actions the patient takes next. Professor Dr. Tariq Mohsen has designed an evidence-based pathway to guide patients through this phase. Drawing on over 35 years of experience in advanced thoracic surgery, his protocols map out exactly how the body rebuilds itself. The division of labor is clear. The surgeon is responsible for survival and structural repair. Optimal functional recovery, however, depends entirely on the patient's strict adherence to post-operative procedures. Medical practice previously relied on a passive recovery model. Patients were prescribed prolonged bed rest and provided with standard, undirected hospital diets, which slowed circulation and left respiratory systems stagnant. Modern clinical outcomes require an enhanced recovery pathway. The patient must act as an active participant, engaging specific bodily systems to force the healing process forward. This schematic outlines 4 precise pillars of modern recovery: targeted nutrition, respiratory kinematics, early mobilization, and optimized sleep. Together, they restore optimal pulmonary capacity. Ignoring any one of these medical interventions creates a deficit that actively compromises the structural work performed in the operating room. By treating daily habits, eating, breathing, and walking, as prescribed treatments, patients drastically reduce the likelihood of postoperative complications. Zooming in from the hospital room down to the microscopic level of the thoracic wound site, we see the sheer scale of biological work required. The body must undergo myofibrillary regeneration. Reconnecting cut muscle and stabilizing the chest wall demands an immense volume of protein synthesis. In this cross-section, macrophage cells clear surgical debris, preparing the environment for protein structures to rebuild muscle fibers. If the diet lacks precise amino acids, this mechanism stalls. Macrophages clear debris, but new tissue cannot form, leaving the site vulnerable. When this repair cycle is starved of biochemical inputs, the respiratory muscles remain weak. The patient loses the physical strength necessary to expand their chest and breathe deeply. Post-operative eating serves a specific biological purpose. It provides a targeted delivery system of materials required to fuel cellular repair and sustain the immune defense. The primary dietary sources for this structural repair include grilled or steamed fish, lentils, chickpeas, fava beans, and homemade bone broth. These deliver the exact proteins needed for tissue synthesis. The body also faces intense oxidative stress triggered by the trauma of the operation itself, creating a secondary physiological demand. To neutralize this stress, the recovery protocol prescribes specific antioxidant-rich produce. Zucchini, spinach, celery, apples, and pomegranates deliver the necessary micronutrients to manage this cellular strain. Healthy fats are introduced to complete the nutritional profile. They actively modulate the immune function and reduce chronic swelling around the incision points. The optimal sources for these fats include extra virgin olive oil, avocados, almonds, and flaxseed. Consuming a daily plate composed of these specific, natural ingredients functions as a localized biological medicine for the recovering thoracic cavity. Conversely, certain foods actively threaten the acute healing phase. Pro-inflammatory compounds hijack the immune system, diverting its resources away from tissue repair. The protocol forbids full-fat dairy, fried foods, processed meats like sausages, refined sugars, and commercial sweets. Looking at this cross-section, an inflammatory diet triggers a rapid buildup of thick mucosal secretions, clogging the respiratory tract. Processed foods also generate severe gastrointestinal bloating. This expanded stomach pushes upward against the diaphragm, mechanically restricting the lungs from fully inflating. There is an absolute zero-tolerance policy for all forms of smoking and alcohol consumption. These introduce direct toxins that catastrophically reduce tissue oxygenation and stall the healing process entirely. Eating forbidden foods actively sabotages the surgeon's repair work. It creates internal physical barriers that prevent the patient from breathing fully and clearing their lungs. Beyond biochemistry, the physical biomechanics of the respiratory system require constant maintenance. If a patient remains stationary and takes only shallow breaths due to post-operative pain, they face a severe clinical risk of pulmonary atelectasis, the partial collapse of the lung tissue. As shown in this wireframe, the incentive spirometer combats this risk, mechanically forcing lungs to expand to full capacity. Deep inspiration drives air into the lowest extremities, forcing dormant lower alveoli to pop open and remain active. To prevent the newly opened airways from clogging, constant water intake is required. Hydration maintains the liquidity of respiratory secretions, allowing the patient to easily expel them through coughing. This must be paired with early and frequent mobilization, primarily through a routine of daily walking. The physical act of walking stimulates systemic blood circulation, while forcing the body into an automatic, involuntary rhythm of deep breathing. Constant hydration thins the internal fluids. Spirometry mechanically opens the deep lung tissue. Walking mobilizes the entire system to clear those fluids out. Success in the recovery phase requires structuring the patient's entire 24-hour day around these distinct physiological tasks. The morning protocol begins with whole-grain carbohydrates and plant proteins, such as fava beans dressed with olive oil, paired with early and deliberate hydration. Midday requirements center on lean proteins, like a portion of grilled fish, alongside steamed vegetables. This nutritional intake is actively broken up by scheduled intervals of walking. The evening protocol shifts to easily digestible items, such as lentil soup, and concludes with a final, structured session of deep breathing exercises. The cycle concludes with uninterrupted, high-quality sleep, the period where the body allocates its maximum resources for final, overnight tissue regeneration. The post-operative daily routine operates as a rigorous clinical checklist. Completing each task guarantees continuous, measurable progress in lung function. Post-operative recovery is a strategic partnership. The surgeon completes the physical repair, but the patient acts as the final executor of the surgery's overall success. Professor Dr. Tariq Mohsin's directive relies on strict compliance. Natural nutrition, regular hydration, persistent movement, and disciplined breathing exercises are non-negotiable. The physiological outcome of adhering to this protocol is the complete restoration of respiratory capacity and a swift return to a fully active, unhindered life. By mastering this evidence-based process, a patient builds the biological foundation necessary to turn a vulnerable post-operative state into a resilient, fully functional future.